Hello everyone, this is Stephen-Castro, and I'm going to do a quick recording for the assessment of nose and sinuses. Not typically a section that we would have on a traditional head-to-toe assessment unless there is a specific problem with a patient with their nasal cavity or sinuses, and then you would want to do a further nose inspection. But there are times when we should do a general nose assessment when we do procedures such as an NG tube or other procedures. You may have to do a more in-depth assessment of the nose. So we're going to cover some different techniques with assessment of the nose. All right, in general, you're just going to inspect the nose. Remember, we start with our inspection. You're going to look at the contour, any surface characteristics, and the nares to make sure that there's no flaring. Flaring indicates that there may be a respiratory issue, particularly in pediatrics. The skin should be smooth and it should be uniform with the rest of the body or the rest of the face. And just pay attention to the contour to see if it's symmetrical. Maybe there's a history of a fracture or a deviated septum or anything of that. So we're just doing a general inspection initially. You'll do some gentle palpation. Just palpate the nose. Just check for any tenderness, masses, or any instability. Just make sure that that bony cartilage is stable. And then we check the patency of the nares just to make sure that they're nice and open and the patient's able to breathe. Remember, that is the primary airway. You'll ask the client to occlude one nare, just, stick their finger on the side of it and ask them to breathe in and out with the mouth closed, and to make sure they can breathe easily in and out that one nostril. And then you're going to repeat that process with the other nostril. I have given an example of this in my demonstration video. And then we would check the cranial nerve number 1, which is the olfactory nerve. You're basically going to repeat that process, but you're going to use a smell, and you're going to have your client close their eyes. After we check the patency, use 2 different familiar smells. You'll have them occlude one nostril, and you'll have them smell the item and then have them describe it to you, and then you discard that one, and then you have them occlude the other nostril and then have them smell the second item. It's my strong suggestion to always use the lighter scent. If you have a lighter scent versus a more stronger scent, use the lighter scent first, because sometimes if you have something really strong and overpowering, it will mask the lighter scent. Please note that the elderly may have a decreased smell, which causes also a decreased taste of food. And also with the COVID virus, they noticed that some symptoms for some of the clients are lack of taste and lack of smell. So it may be important in the near future to do more significant testing for the cranial nerve 1. And again, we're looking at the breathing pattern. Remember, that's even pediatrics, they're obligate nose breathers. Most of us, everyone uses the nares as their primary airway source. We don't typically breathe through our mouth unless we have to. It's through the nose. It should be noiseless, meaning it's open and patent, and air is able to easily flow in and out, hopefully with no nasal flaring, and that's when the nares will flare out to try to bring in more air. Again, that's typically a sign, if you see that, of some respiratory distress or having some issues with breathing. Just review the nasal structures. And then you can inspect the nasal cavity. You don't need an otoscope to look up the nasal cavity. You can just use a pen light, and we generally just have them kind of pull their nose up a little bit. Just use a good light source. I did demonstrate this in my video. Just kind of have them pull the tip of their nose up so you can look up adequately, and use gloves if needed, especially if there's a lot of drainage. You're going to inspect for the color of the membrane inside the nare. If there's any type of discharge, and clear discharge is normal. Any masses such as a polyp or abscess, lesions, swelling, and if you can see the little turbinates, and you can kind of look, there's the image there, look for the inferior and middle turbinate. You may or may not be able to see those. We're just making sure that we don't see anything abnormal and that the mucosa of the nose is nice, pink, and moist. Look for the septum to see if the septum is deviated. And if it is deviated, you can kind of look up there. It'll shift from one side to the other. It's not symmetrical. Check for alignment, make sure it's intact. There are times when with some illicit drug use, particularly cocaine use, if there's a lot of cocaine use, they can actually wear a hole through that septum, and you can kind of see that. Also now, the piercings are very, very popular, so you can see frequently that they have the piercing in the septum. But we're basically looking for the intactness, the basic symmetry. If there's any deviation, have they had any history of any fractures? Again, that perforation, if it's a small hole, it might be from a piercing. If it's a larger hole and it's a little further back, that may be due to illicit drug use. And check for any bleeding. And this is a picture of a perforated septum on the right. That's kind of what I was referring to from cocaine use. And then on the left, this is a polyp. That's kind of a little growth that can grow up inside the nose. And it can be concerning, and it's definitely something you want to refer up to a provider. It may be benign and they can remove it, but it can occlude the airway. And there's a small chance that they could turn into something cancerous. The assessment of sinuses, again, not something typical. I'll just kind of review it for you. It's something typical a nurse would do with more of an advanced practitioner. And here shows the different sinuses. You have the frontal sinuses above the eye, the ethmoid, which are just kind of on the inside of the eye, your sphenoid, and your maxillary. Typically, the main sinuses that give people difficulty if they're having a lot of pain or fullness are going to be your frontal sinuses or the maxillary sinuses, and sometimes the sphenoid sinuses. You would, again, inspect initially, just kind of inspect in general, and then you'd palpate those sinuses and possibly percuss. The reason practitioners would percuss the sinuses is because typically the sinuses should be hollow and open, but with a lot of fluid infections, sinus infections, they would be filled with fluid. So when you do the percussion, the tone would be different. It would not elicit that hollow tone. It would have a tone of fullness. So that is why they do the percussion of the sinuses. Transillumination, you could use your pen light to illuminate the sinuses, and I encourage you to do this in the bathroom on yourself. It's kind of interesting. You can put your pen light, sorry about that, I wanted to let the trash truck go by. You can put your pen light under your sinuses. It will illuminate it, particularly in a dark room. Again, if the sinuses are full, that light would not be transmitted as clearly as if it's hollow. Full as in if there is some type of a fluid or sinus infection. Again, those air-filled sinuses are going to be faintly visible as red. Look, there's lots of secretions in there. They're going to be less transluminant. So I encourage you to go to the bathroom, illuminate your sinuses, and just kind of see what a normal sinus cavity may look like with that. Here's a couple of video links for that if you want to see that as well. Geriatric variations, again, sometimes they have some decrease of smell, atrophy of that olfactory buds. They do have some concerns with their cranial nerve 1, and that also will affect their decreased taste and affect their taste buds. That is it. If you guys have any questions, please don't hesitate to ask.